Good evening, this is Eswatini TV News at 8. I am Nathalie Sitole alongside Makabiso Ngambule. First up, let's have a look at our top stories. His Majesty King Mswati III continues to engage strategic development partners of the Kingdom of Eswatini in the United States of America. The Minister of Health has announced the Cascade SHIMS 3 results among people living with HIV in Eswatini. Eswatini TV will broadcast live the 2022 FIFA World Cup in Qatar. The news. His Majesty King Mswati III continues to engage strategic development partners of the Kingdom of Eswatini in the United States of America. The King has held talks with the United Nations Development Programme Regional Director Africa, Ahuna Eziakona. His Majesty is accompanied by Ngosikati Mage Langangaza in his working trip to the United States.
So wonderful.
His Majesty the King and the Regional Director met to deliberate on a new youth empowerment program by the United Nations Development Fund. The program is aimed at supporting the youth in Africa who want to engage in entrepreneurship to mitigate the issues of poverty, and funds will be set aside to get it underway. Only 8 countries in the continent will be selected to be part of the highly contested program, and the Kingdom of Eswatini is among countries that have positioned themselves for selection. The project can contribute to the reduction of youth unemployment in Eswatini. During the talks, His Majesty the King continued to make the welfare of the youth in the country a top priority. Eswatini has a number of youth empowerment programs that demonstrate His Majesty's commitment to address challenges faced by the youth. On Wednesday, His Majesty addressed the United Nations General Assembly and called the program a noble idea that Eswatini is ready to embrace. In New York City, I am Sandile Makanya for Eswatini TV News.
The Minister of Health, who was represented by the Minister for Sports, Culture and Recreational Affairs, Harris Bulunga, has announced 95 Cascade SHIMS 3 results among people living with HIV in Eswatini. Bulunga says this is an important report because it means Eswatini now has an opportunity to observe trends over time in its HIV epidemic responses.
The Minister of Health, who was represented by Sports, Culture and Recreational Affairs Minister Harris Bulunga at the Eswatini Population-Based HIV Impact Assessment SHIMS 3 report presentation, says the results from the assessment highlight the sustained progress that Eswatini has made towards HIV testing and treatment over the past 5 years, despite COVID-19 disruptions.
On behalf of the government of the Kingdom of Eswatini, it is my honor to announce the SHIMS 3 Cascade results. 95 targets. Overall, SHIMS 3 participants 15 years and older were at 94, 97, 96. Females were at 95, 98, 96. And males at 92, 96, 97.
The United States Ambassador to Eswatini, Gian Maloney, says it has been through remarkable partnerships and collaboration between all involved stakeholders that Eswatini has made significant strides in ending AIDS as a public health threat.
We stand here bearing witness to the remarkable power in uniting toward a common goal, the power of partnerships, the effective use of evidence-based tools, and the result of having the courage to take action even against the backdrop of one of the most severe epidemics in the world. To highlight just a few of the successes we should all be proud of, life expectancy has returned to pre-HIV epidemic levels of over 60 years.
Minister Bulunga also encouraged all healthcare workers to study existing gaps and refine HIV programs so that Eswatini can achieve control of the HIV epidemic. Sifiso Ngumalo for Eswatini TV News in Mbabane.
The Minister for Health, Lizingosi, says public health facilities will have less traffic with the introduction of Lidwala medical aid. The Minister was represented by the Director of Health Services, Dr. Vusi Makakula, during the launch of the Lidwala medical aid. Makakula says the medical aid will assist in increasing the number of Maswati who have access to private health facilities.
In a bid to ensure that eMaswati are able to receive health services from public and private health facilities, Lidwala Insurance has launched a medical aid that will accommodate low and middle income earning citizens. Officially launching the Lidwala medical aid, the Minister for Health, Lizinkosi, represented by the Director for Health Services, Dr. Vusi Makakula, says eMaswati will now be able to access health services from private hospitals, which will assist in minimizing traffic in public hospitals.
To the Minister of Health, this is a win for us, as Lidwala is determined to work with public facilities, which will greatly improve our service delivery through knowledge share amongst the facilities, especially from the system's point of view. Adding to this, the uptake of the capitation product will help alleviate the load from the public facilities, as traffic will now be channeled also to the appointed private healthcare.
The Minister for Economic Planning and Development, Dr. Tambokina, says the medical aid will directly contribute to the attainment of the first world status.
It is for the affluent, for the middle income, for the low income, and we provide access to quality medical services to our nation. This is a direct contribution to His Majesty's dream of a first world status.
Lidwala Health Managing Director Dr. Thokozani Kambule says they are committed in providing services that people really need.
Our commitment to you as our stakeholders and to the wider nation is to continually improve our total customer experience through offering relevant products that meet customer needs at competitive pricing.
Lidwala Insurance Board Chairperson Michelle Shakantu says the main aim of Lidwala Health is to enhance the quality of life for eMaswati. Lidwala Insurance has been around for 16 years. For Eswatini TV News, Sondomlangeni Themba Shabangu, Ezulwini.
The Principal Secretary at the Ministry of Health, Dr. Simon Zwane, says the ministry is working on improving drug distribution, and the Central Medical Stores is also improving systems to address the issue of drug shortage in the country. Zwane was speaking in Parliament when appearing before the Public Accounts Committee on Friday.
Before the Public Accounts Committee, PAC, started deliberations on the compliance audit report by the Ministry of Health, the committee asked for answers from the Ministry of Health on the now frequent issue of drug shortage in the country. The Principal Secretary at the Ministry of Health, Dr. Simon Zwane, in response said the situation is improving and the Central Medical Stores in Matapa is working on improving systems to improve drug distribution.
Akhona ama improvements, Chair. Kodwa ke nathi la sikhona khona akusiyo indzawo lengathi we are happy to be. Ikakhulu ngoba kuhle kuba khona angithi nje ukhanza kwekuthi sekunetinhlobo tsite letingekho sanhlobo letikhinyabeta kakhulu ke kusebenta kubo betempilo, kungaba kusesibhedlela noma kusemaklinik. Mane ke sekunalomnye umsebenzi lotawo improve yona i-visibility yawo maphilisi e-Central Medical Stores migrator from one system to a better system. Le faka bo barcoding sebabhizi ngako ke kulamalanga, so le issue ye distribution isengakabuyeli ezingeni lelifanele. However, nangabe sibhedlela sikhala sithi inyanza leyo seside nangumuthi nangu ayentiwa emergency orders.
Zwane also responded to the committee's question, saying it should shed light on the current unavailable drugs.
Lobulukhuni lesenabonyalo kakhulu ngilokwe ukuthi ayangena amaphilisi angene Central Medical Stores lapho siwastorisha khona siwalungiselele kwa distributor. Le Central Medical Stores kudzinga ukuthi sathi ukuthi kungena ini inganani kunganani lokukhona kunganani lokuphumako njalo njalo. Ngilebe sikwenda ke lokho manje nje sesenyusa standard ukuthi sikwende kangcono lokwe ukuthi le system lesifaka konyalo ingcono kunale besiyisebenzisa lebe sisebenzisa behle ibanako lokusukwende manually.
The PS further assured the committee that the ministry will continue to work tirelessly in improving drug distribution in the country. Reporting for Eswatini TV News, I am Samkal Siwekoza with Kumbuzo Dlamini, Parliament.
On another note, the Principal Secretary at the Ministry of Health, Dr. Simon Zwani, says the government has since de-escalated the COVID-19 response. COVID-19 tests are only done at healthcare centres. Zwani was speaking in Parliament when the ministry appeared before the Public Accounts Committee.
When the Minister of Health appeared before the Public Accounts Committee on Friday, the committee asked the Minister of Health to shed light on the current state of the COVID-19 pandemic in the country. Finishing the Honourable Committee with responses, the Principal Secretary at the Ministry of Health, Dr. Simon Zwani, said the government has since de-escalated the COVID-19 response and COVID-19 tests are now done in healthcare facilities.
We still have people getting infected by the virus, and unfortunately, now buka ke lizinga lethi sijove kangakanani sisengakefiki 40%. Kanzi lucwaningo noma ke science isitshela ukuthi nasingefika ku 70% siba sezingeni ke la khona ema communities ethu angaba protected. Lesikwendile ke lokunye checkwe ukuthi kule ndlela lesisebenta ngayo indzaba ya COVID sibese senda nakulokuthiwa i-integration. Lokusho ukuthi sesingeke necessarily sibe nesiteshi sithi lapha sitesta i-COVID njengoba besenda. Kodwa sekutawuba la kule ndlela lesenda ngayo siletha ngayo indzaba ye-clinical services even. Lokusho ukuthi nje uma ngiya ngiphethwe ngumkhuhlane ngitisola nangifika la bodokotela bangibona, they will determine ukuthi asambe siyokwenda i-test ye-COVID. Solo siyayitesta i-COVID e-laboratory eMbabane. Kodwa ke how we do that nyalo sekuba ngilokwe ukuthi lona lonika tempilo asole ukuthi kungenteka ukuthi unemkhuhlane nje lo ongawutholi kahle athi asisambe so checka i-COVID. So ke sesibambe kanjalo che noko solo siya khangasa futhi siyakhongosela eMaswatini kwekuthi akachubeke ajove ngoba umjovo ukhona. Sinelihlobo lunyeko lwemjovo lo aka Pfizer.
The PS said it is therefore important that everyone takes the necessary precautions to prevent the spread of this unpredictable disease, including wearing of face masks if not feeling well or when having flu-like illness, as well as washing hands with soap and running water as frequently as possible. Reporting for Eswatini TV News, I'm Samkal Siwekoza with Kumbuzo Dlamini, Parliament.
The Eswatini Nazarene Health Institute CEO Benjamin Simelane says the institution is working on a turnaround strategy to address accumulated deficits and unremitted taxes amounting to 328 million emalangeni. Simelane has been speaking in Parliament before the Public Accounts Committee.
When the Public Accounts Committee PAC convened for parliamentary work on Friday, the committee requested answers on the unremitted taxes amounting to 328 million emalangeni for pay-as-you-earn and accumulated deficit of over 300 million emalangeni of the Eswatini Nazarene Health Institution. In response, the institution CEO Benjamin Simelane said the ministry has since increased their subvention with 15 million emalangeni and they are working on a turnaround strategy.
Ilizinga lekunciphisa i-waste waste esibhedlela nekukhulisa ama-efficiencies. Logo sibona lokuthi asithole kusitakala ngokusitwa sibe ne-internal audit besithi internal audit but nyalo sesinaye SNG grant. Bese ke ngibuya kulendzaba ye-liquidity problem. Isibhedlela nasinakhona lapho solo sibambisene nelitiko ukuthi kuba khona indlela standard letenda kusukube ngcono.
Members of the committee then forwarded their supplementary questions.
Uthinze indzaba ka overtime kuthi indawo zama reduce ngendzaba ba on call. Ngabe kumbe tinyonyane senithi engage le yini controlling officer because mawubuka lendaba on call ngilala khona beva ngathi ba comfortable khona ngathi ngila khona le make money.
Lesibhedlela seNazarene ubani umnikati waso ngikubuta lokusihlalo ngoba kusekwavela netindzaba nje ngitawubekisa demabhodi lapho khona wena controlling officer ukhanye ukuthi awusakhona ukufinyelela kuletinye tindzaba ngoba wena ugcina ngokuthi ufake nemali.
Mhlawumbe sibadala nyalo because sifuna ukuqualifya kuleli fastelo lelivulwe nge-RS. Kanti i-reality ithi vele kusahamba kabi.
Ngifuna lokuva ukuthi lama board members lawa la khona akuma sitting allowances noma ku monthly salaries. How frequent do they meet?
The CEO then responded to the debate.
Sisibhedlela selibandla leNazarene kepha labe seliba nesivumelwano nahulumende i-MOU. Kule MOU ngilapho khona ke bahladiye khona lokuthi kutawubanjiswana kanjani hulumende nelibandla. Kepha ke angilikhipha ngalokuphelelele lokuthi hulumende nguye lo sibambile lesibhedlela ngendlela yokuthi sisebenta phasa lo mthetho we-PEU.
The PS at the Minister of Health, Dr. Simon Zwane, said government needs to up the game in supporting these institutions to improve health service delivery. Reporting for Eswatini TV News, I am Samkal Siwekoza with Sikumbuzo Dlamini, Parliament.
Eswatini TV Corporate Affairs Manager Mncedisi Maisela says Eswatini TV will have a live broadcast of the 2022 FIFA World Cup. Maisela officially announced this news at a briefing with local media houses. We have a report.
Eswatini leading public broadcaster will broadcast live the 2022 FIFA World Cup, which will be taking place in Qatar. Eswatini TV Corporate Manager Mncedisi Maisela, who spoke during a press briefing, says the World Cup, which kicks off from the 20th of November until the 18th of December, will be televised live courtesy of a partnership deal between Eswatini TV and Eswatini Mobile.
We will be televising live the World Cup 2022 in Qatar. Further to that, we further announce as Eswatini Television Authority that we will also have something that we have never had before, what we refer to as fan parks. We are hoping that Eswatini, in all their numbers, will be tuned into Eswatini Television watching the World Cup. And further to that, we also hope that Eswatini will be able to walk into the fan parks to have fun.
Eswatini Mobile Marketing Manager Cynthia Simelane says they are glad to partner with Eswatini TV to bring the FIFA World Cup 2022 live for Eswatini.
As a Swazi brand or a brand, a locally owned telco, we are proud to have partnered with Eswatini Television to make sure that the World Cup is brought live and Eswatini enjoy that experience during the November-December period.
Eswatini TV Marketing Manager Sboniso Mawelela says fan parks with entertainment ranging from performances from local artists and kids zones will be placed strategically in different areas around the country. Sifiso Ngumalo with Sbonelo Mamba for Eswatini TV News in Babane.
The Director of Micro, Small and Medium Enterprises, Mluleki Dlamini, says the youth should be trained on leather crafts so that they will be able to start businesses in this sector for financial sustainability. Dlamini was speaking at Kodek in Eswatini when closing a leather craft workshop that was hosted by the Taiwan Technical Mission.
The government of Eswatini is currently working to create job opportunities to contribute to this drive. Since Monday this week, the Taiwan Technical Mission has been training business holders on how to use leather to make products. The Technical Mission's coordinator, Joseph Peng, says they targeted businesses at grassroots level.
We want to provide more opportunities for the Eswatini women. So that is why we just are looking for some potential industry, just like this one, laser industries. We wanted to help them to develop their business.
The Director of Small Medium Enterprises, Mluleki Dlamini, says he wishes to see more young people taking up projects in the leather craft. He says this will provide them with long-term economic independence.
Kakhulu ngicela nje nokuthi nibokhuthatha le youth ukuthi nayisonzele kulomsebenzi lona nabomake kanjalo basonzele bakhona lokuthi lo msebenzi lona ubaphilise nabo kulamabhizinisi ngoba siyabona lokuthi nase sewukhanza ukuthi senigcinile kule skill nale knowledge ngilapho sesingasonzeta khona abatshali imali kunabo sebabona lokuthi cha sebacinile labantu kule skill.
Stanley Lukhele and Tumsile Simelane, who were part of the training, say they have been provided with necessary skills for the industry.
Sine nje lokusesifundisiwe la tikumbe tinenge besiyesi batithathe tiye South Africa. Nyalo nje sesicela uhulumende asilekelela sitholise lemishina sibe nale tenary letikhumba tingasaphumi kuya ngaphandle. Tibe la ekhaya kangwane kube ngumkhicido wala sinathi sine sisebenza ngetikhumba sitithenge khona la sichubeke.
Sinyalo sesiyati ukuthi tikhumba lesitihlatshwako atisalahlwa sesiyatikweleka siyatipreserve ukuthi tibe ready ukuthi sikhone ukutithenga.
The government of Eswatini is introducing vocational skills in universities and schools to increase entrepreneurship. For Eswatini TV News, Nelson Dlangamandla with Themba Chabangu, Zulwini.
The Director for International Office Director Naked Tunnel has encouraged Eswatini to apply to study in Cyprus University. Naked says Eswatini will have an opportunity to acquire marketable skills.
Eswatini students can now be able to apply to study in Cyprus University. According to Naked Tunnel, the International Office Director, the university offers an educational environment where international students come together.
BAU is a very different system, and it's a family actually. And I brought a BAU passport for the students, which means that once they enter any of the BAU, they can transfer 4 of their semester to any of the other universities in the world we have, and they can have 4 different visions, not getting one piece of paper called degree or diploma on one campus for 4 years, but they will go to 4 different campuses, get 4 different visions, and they will have 4 different communication places in the world, and they will come back and add a multicultural vision to their country. We are giving 50% scholarship to all the Eswatini students. We are giving 75 and 100% based on their merits. We check their high school documents, and according to that, we have a BAU office also, and here in Eswatini, and they're taking care of all the students if they need any other intention. But it's very easy to enter Cyprus. You don't need a visa. You just get a 3-day transit visa for Turkey, and then you can come in, and then you do your immigration. It's a very easy process, and Cyprus is the 3rd safest island on the world. The crime rate is below 1, and the students are very safe. They've been taken care, and there are lots of opportunity which is waiting for them. Application process is very simple. You have to send your high school documents. If you're doing Cambridge system, you have to send 8 O levels or pass 2 A levels to our office, which is the address has been provided everywhere, but we can give it to you too, with a copy of their international passport. And then we send them their preconditional letters, and there's the initial payment they have to make before they come. After that, they get their final acceptance letter and they can come. Depends on to all the Swazi students who will apply. There is no limit. At the moment, we have already given admission to 15 students from Swaziland. And the admission is going on till the first week of November. After that, we will stop, but we will start again in December because we have 2 intakes. One is fall, one is spring. So fall will end in November, and then in the end of December, we will start the spring.
Naked says it is easy for students to study as there are no complicated documents required. For Eswatini TV News, Sondomlangeni, Tandokuhle Mdluli, Mbabane.
And now we'll have a look at our financial markets.
Bank, it can be.
Moving on, we'll have a look at our sports news. Eswatini national under-23 have placed themselves in the driving seat ahead of their second leg encounter against Botswana. Eswatini won the first leg of the 2023 Africa Cup of Nations qualifiers 2-0. The game was played at the Zomhlolo National Stadium.
The national under-23 of Eswatini have not been in action for over 2 years prior to their game against Botswana in an AFCON qualifier at the Somhlolo National Stadium. From the get-go, Eswatini were firing on all cylinders and eventually they scored the first goal of the match, which was scored by Bongiswa Dlamini just before the halftime break. Early in the second half, Sambulu Masoso Smelane got Eswatini's second goal, which turned to be the winning goal for Eswatini. Eswatini's coach, Fiso Nyurundiwane, after the game said preparing for the first leg was very difficult considering that they haven't played in a long time.
You could say last 20 minutes, my boys were tired, match fitness. But during the period while we were preparing, we played a lot of friendlies with very strong local teams. That has started the way back to train, and we also went to Mozambique. So our preparations were spot on in terms of every 2 days we're playing a game, every 2 days, 3 days we're playing a game. So it has pushed the boys to be at least 70%. We knew that we must push them up until 70 minutes, then we will close shop if we've got something in the bag. Then that away goal, we didn't need that. So that is why last 20 minutes after getting the second goal, we were very cautious because we knew we are going away. They mustn't get an away goal. And fortunately, we managed to do that.
Kaelo, who is Botswana's head coach, says he is anticipating a positive result in the second leg back in Botswana.
If we could, have a good, game back home, we should be able to reverse the deficit. The plan was, as I said, was to ensure that at least if we lose the game, we shouldn't lose by more than 2 goals. So it happened that we considered those 2 goals. But under the circumstances, if we had looked at that game, watched the game, the second one was a silly goal. We shouldn't have considered that goal. So I think overall we are going back